5 things I wish I knew before starting dental school. Stay tuned. Hello everyone, welcome back to another video. My name is Teham and I am a second year dental student at ASDO. Timestamps for the video are going to be right over here, so feel free to scroll along through any part of the video that you think is going to be most worthwhile to you. And as always, if you find anything of benefit, be sure to leave a like down at the bottom and let me know what you think in the comments. The One Mission DMD podcast conversation videos here on YouTube are now on Apple Podcasts and Google Podcasts. We'll be updating everything on a weekly basis with the material that we have here on YouTube, so stay tuned for that. If you haven't checked out any of the podcast conversation videos, go ahead and check them out. We talk with pre-dental students, current dental students, students that graduated. We try our best to answer any of your questions and learn from other people along the way. So go ahead and check it out. As this is acceptance season for dental school, this is the time where everyone starts researching what their first year is going to be like, what they need to watch out for, and just any advice that they can possibly get. So given my experience thus far, these are the things that I think any student should know before starting. Empty your mind. Because whatever experiences that you've had as a pre-dental student, a dental assistant, or anything in undergrad, it's limited. And even if you think that you're already decided on a particular specialty, you only had experience with that one specialty most likely. In dental school, you're going to learn a lot through different types of people, through different specialists, and there's no better place to learn about those things than in dental school. Just think about it. In undergrad, how many people change their majors? And if you already set your mind in terms of what specialty you want to go to after dental school before you're in dental school, it's kind of premature. And honestly, a lot of people going into dental school decide to change whatever specialty plans they had before they started dental school. So just make sure you have an open mind. If you have a goal, keep it, but definitely know that you're probably going to learn something in dental school that you didn't know before. So definitely keep an open mind. The second thing is you don't want to compare yourself. Obviously, you're going to be seeing how you perform on exams, and you might be comparing what you got to the class average. That's okay, just to know where you stand. But one thing I wouldn't advise comparing yourself in would be in sim clinic. Everyone is learning something different. They're learning hand skills. You're learning how to control your hands with the handpiece and fine-tune those motor skills. Everyone is going to perfect their hand skills to a clinically acceptable level after sim clinic. So even if one person took one try to get a perfect crown prep and you took 10, at the end of the day, it doesn't matter because you're at the same level. The only thing you should be comparing in sim clinic is your prior work. Save all of your teeth, all of those plastic typodont teeth, save everything, and then just compare it to what you do a year later. You'll be so shocked to see how much you improve within a year and how much faster you're able to do things. So definitely save everything so you can compare everything to your old work. And at the end of the day, if you're improving in the quality of your work, that's all that matters, because that's the only thing you should be comparing, your own work. I did not think I would have any free time before I started dental school, but when I started my first year, I saw that we were pretty much just doing didactic coursework. Yeah, we went to the sim clinic a little bit, but it was mainly instrumentation in the first couple months. So regardless of what part of dental school you're going to be in, there's going to be some type of free time, and you need to expect that. Whether that be spending time with friends, going to the gym, or just involving yourself in a random hobby. Just gotta find something to keep yourself sane, because at the end of the day, you need to be doing things that are fun outside of school as well. So definitely do that. So in my case, half of my class is going to school in the morning and the other half is going in the afternoon. And every week that changes. So if I'm used to going to the gym in the mornings one week, I have to flip it and go in the afternoon the other week. So you definitely don't want to fine-tune everything to a certain time, because everything is going to be changing a lot. Just make sure to have something to do and know that you might have to change the time of day that you involve yourself in that activity. Now this sounds so simple, and obviously you want to make sure to be practicing everything didactically, hand skill wise in the sim clinic. So the class of 2023 was actually the first dental school class that just started sim clinic and had an abrupt halt because of quarantine. So when we came back, we had to continue where we left off. We had less time in the sim clinic to work with. Now, because of that, I knew I needed that extra practice. Now, when we came back, half of the class was going in the morning, like I said, and the other half was going in the afternoon. So we had less time in the sim clinic to work than we had been going prior to COVID. So because of that, I knew I had to do something to continue practicing, so I put together an at-home dental unit. And if you think you can benefit from that, and if you're about to start dental school, go ahead and check out this video where I went over all the contents and how you can get it going for $310. Now, companies make these all-in-one at-home units, but they charge anywhere from $1,000 to $2,000. I wasn't trying to drop that amount of money, so go ahead and check it out. It really helped me a lot in some classes in sim clinic. I don't really use it anymore, but it definitely helped me a lot when we came back from COVID because I didn't have that time to be able to practice in sim clinic. So yeah, if that's something you're into, go and check it out. This is something so different, man. You can't really just go and study for this. It's a very unique thing, sim clinic. You know you have a progress exam tomorrow, but you can't really do anything the day before except for like watching videos of Stevenson Dental. That's actually a really good resource to use. Go ahead and check it out. They actually go over everything that you'll be doing in sim clinic regarding crown preps, operative dentistry, all that stuff. It's a really good resource, but you can't actually physically do much to prepare for it. That's what makes this a little unique and different. Whatever means necessary for you to practice, take advantage of it. If they give you extra hours in the sim clinic to go every single time. Dental school is tough, man. It's challenging to juggle between didactic and sim clinic at the same time. Now, if you didn't fail anything in didactic, you might fail something in the sim clinic, and this goes for even the top 10 people in your class. There's just so many elements to it all, having to juggle between those two things, and no one gets 90s on all didactic and all sim clinic. It just doesn't happen. So what are you supposed to do when failures happen? You have to learn from your mistakes, and again, you have to practice. That's the most important thing. When I was struggling with some things in sim clinic, I reached out to some upperclassmen, and they told me they struggled with things in sim clinic too. One of them told me that they had to remediate a preclinical competency because they didn't do well the first time. Obviously, they were upset in the moment that they had to redo it, but they were so appreciative of the fact that when they went to the patient clinic, they were ready. That person said that even if they passed that clinical competency the first time and went down to the clinic, they wouldn't feel comfortable doing it on the patient. At the end of the day, the remediation is not just for you to pass, it's for you to feel comfortable. It's for you to prove to yourself that you can do what needs to be done on plastic teeth and then down in the main patient clinic on patients. So take your remediations as an opportunity to improve on whatever needs to be improved. Go and get everything checked by the faculty before you remediate it so you know what you need to be improving on, and practice as much as you can before those remediations happen. Anyways, that's the end of this video. Hope you guys were able to take something away from it, and those were the things that I wish I knew going into dental school. Catch you guys in the next one. Peace.